Hello, my name is James, and today I'm pleased to share with you some business idea that I thought if actually it favors me, it could be favor one or two people also on this platform. Now, I have a business idea. I wish to establish a pharmacy in a rural area back in my village. And the main reason as to why I chose to establish that pharmacy in the rural area, it's because in my region, in my rural area, that's in rural area where I come from, is that we have the area is actually marginalized. When I say marginalized, I mean the area is inaccessible in terms of roads, the infrastructure is poor, we also have very limited pharmacies that are around. So you understand now the people are competing for the limited resources that are available. For instance, if someone, if a baby has a cold flu, the baby is actually taken to the hospital, and after being taken to the hospital, the baby is given a prescription to go and buy a medicine from outside the hospital because there are no drugs within the hospital. That becomes also another challenge. But then, where is this baby going to buy that drug? Because pharmacy or chemists that are around are very limited. So you realize accessing them, those chemists also becomes another problem. So the baby has gone to hospital to be treated. Of course, he has been assessed or she has been assessed. A condition or an indication has come up that the baby has respiratory tract infection. So the doctor or the clinical officer writes a prescription for the baby to go and buy the product from the chemist outside the hospital. Now, getting that drug becomes a challenge. The resource or the money to use to buy that drug becomes a problem, because that gives us a second point. Because in rural areas, prices of the drugs are sort of exaggerated, because you realize a drug that is being bought in the urban center 100 shilling, it's being sold in the rural center at 200 and 180 shillings, Kenyan shillings. In real life, that becomes a challenge, because when you ask why, you are told that the going to collect the drugs from the distributors in town and bring it here becomes also another challenge. So they say the transport fees also put on it. So you realize they are garnering double the price that is supposed to be sold to the patient. And also, number three, you realize, yes, there are chemists or there are pharmacies that are around, but very few of them are registered with the Pharmacy and Poison Board. Now, a drug is something that is being regulated. You realize the people who are in that chemist or who are in that pharmacy, they're not trained pharmacists, they're not trained pharm techs. So it becomes also a problem even to describe or even to explain the drug you're selling to that patient. You're supposed to give a drug to a patient so that the patient gets cured. But then you, as an untrained pharmacy or an untrained pharm tech who is in that pharmacy, you have the powers or you've given that mandate to sell the drug. But then it comes to prescribe or explaining to the patient how to take the drug, it becomes also another problem. You either underdosing or overdosing, which is also another form of drug abuse. And also, just to echo on something, the pharmacy, that are within, being very few in number, they are not consistent, because you realize when the people from the Pharmacy and Poison Board of Kenya, they start surveillance, you realize this pharmacy at some point they close. They close up because they are evading the punishment that actually comes with those people, because they have to close it down for them to evade the punishment, because they are not closing it down because maybe the people from the Pharmacy and Poison Board are harsh or are going to punish them. No, they are evading because they do not have qualified skills, they are not registered, and even the premise is not registered. So on that particular day, assuming the people are in need of drug and the chemist or the pharmacy around are closed, how will the people get treatment? How will the people get drugs? So you realize it becomes useless for someone to go to hospital to buy a drug. So having come to that point, I realize now it's also a high time for me actually to establish a business in that my rural area, whereby I'll feel comfortable, because one, I'll ensure that the product I'm selling are of good quality. Number two, the product that I'll be selling, that's the drugs that we should be selling as that pharmacy, they are pocket friendly to the people who are in that region. Because if a drug, I'm supposed to sell it at 100 shillings, the same price that is being sold in the urban center, why should I not do that? Because one, I'll be buying drugs in large quantity. When you buy something in large quantity, the benefit that comes with it are also large. So I'll always ensure that the patient that I actually am to serve, they are actually getting that drug with a better price. And number two, I will ensure that this pharmacy or this chemistry is strategically placed such that people from all over the place, all over the region, they are able to access the services. For this case, for instance, I will place it in a market center, whereby you realize at the end of the day, it's a must for people to come and buy food stuff and do other things in that market center. So during that time when they are coming to buy, when they are sent to buy drug, at least they can get. Number three, I will also ensure you realize in a rural setting, there are those products that are actually available. For this case, the cough syrups. You'll never fail to get a cough syrup in any rural pharmacy. But then if you go and ask for cardiac drug, if you go and ask for hypertensive drug, if you go and ask for mental health drug, you realize it will be very hard for you to get that drug, because they believe or they assume that in rural areas, those kind of education, they are not there. The same people who are in urban centers are the same people who are in rural areas. Comes a time when the people in urban centers relocate to the rural area, maybe because of some ceremonies, maybe because of some seasons, maybe for this, maybe during electioneering period, you realize people move from urban centers to the rural centers, and during that time, some of them, maybe they are on lifetime medication. You guys getting that drug for a cardiac disease becomes a problem. So for myself, I will ensure that I get variety of drugs that actually are covering all kind of ailment. In case somebody is sick, whichever kind of an ailment that person is suffering from, he or she is able to get that drug from my place. Thank you so much. And I feel it's doable. It's doable because I believe with the study I have done, with the analysis I have done in that region, I see myself establishing this strategy and achieving this project that I'm actually purposing and intending to do. And if all goes well, I believe that this pharmacy will grow to be a health facility that now will be able not just to sell the drugs to the patient, but also to offer them healthcare services. And by doing that, I will always ensure I collaborate with the stakeholders. I will ensure that whatever the pharmacy brings in, it also brings back to the community by maybe ensuring that the cleanliness is adhered to, and also ensuring that borehole drilling is also a key, and also ensuring that there is accessibility of pit latrine, whereby people are able to defecate, because that's also another problem, whereby health begins with you and I at home. When you have a good hygiene at home, you are rest assured that your health is taken care of. But if your hygiene is compromised, then at the end of the day, be rest assured also your health will be done what? Will be compromised. So I feel like starting this business will not only be for my personal interest, but it also serve the people from my community. Thank you so much, and let me see you then soon.